The American Diabetic Association has recently published its recommendations for standards of care in diabetes. It is a comprehensive 300-page document. I thought that it would be useful to remind ourselves of the diagnostic criteria for diabetes. As you can see from this table, there are four possible criteria. Firstly, a fasting plasma glucose greater or equal to 7 millimoles per liter. Fasting means no caloric intake for at least 8 hours. Second criterion, a 2-hour plasma glucose exceeding or equal to 11.1 millimoles per liter during an oral glucose tolerance test. The third criterion, a hemoglobin A1C greater or equal to 6.5%, which is equivalent to greater or equal to 48 millimoles per mole. Fourthly, a patient with classic symptoms of hyperglycemia and a random plasma glucose greater or equal to 11.1 millimoles per liter. Please note that diagnosis requires two abnormal test results, either from the same sample or two separate test samples. If an oral glucose tolerance test is being performed, then the patients should be advised to eat at least 150 grams of carbohydrate for 3 days prior to the test. The document draws our attention to the discordance that exists between fasting plasma glucose, 2-hour plasma glucose, and hemoglobin A1C results. When such discordance exists between hemoglobin A1C and the glucose values, fasting plasma glucose and 2-hour plasma glucose are deemed to be more accurate. The document also reminds us that the sensitivity of hemoglobin A1C at a diagnostic threshold of 48 is relatively low at around 30%. It is therefore a good idea to do the plasma glucose tests as well. When there is marked discordance between the results, one should think about the possibility of hemoglobin A1C assay interference. Apart from assay interference, there are a number of conditions that can affect the result of hemoglobin A1C. Thanks very much.